Hello viewers, welcome to the other session of Postgraduate Diploma in Environmental and Occupational Health. Today we are going to discuss about MEVE 002, that is the health sector. So far we have seen that what are the chemical hazards which are faced by the health sectors. So today we are going to discuss about how to manage the chemical and allergic hazards. So we have already discussed about hospitals. They have many unique hazards that can potentially affect the health of employees. So exposure to occupational hazards throughout the hospital departments, not only a single one, they are highly variable. So chemical exposures that can occur from sterilants, disinfectants, cleansing compounds and hazardous drugs, mercury and anesthetic gases. These are some of the examples of the chemical hazards which they will come across. So some of the biological hazards are also there, like viruses and bacteria, which can cause the hepatitis B and C, HIV and tuberculosis as well. And also some candidates or some people, they are also allergic to latex like compounds. So workplace related health impairments, injuries and also illnesses that can cause a great human suffering and also incur high costs both for those affected, and safety measures and health promotion in workplaces which are aimed at preventing this. So this is a very important issue. The healthcare workers also, they are having a lot of threat. But in addition to the protecting workers from harm, so we want to know and then how the healthcare managers in the healthcare system and how to achieve a health promoting hospitals are also facilitating, which is according to the some of the criteria, that is the World Health Organization systems. So the World Health Organization, the definition of health, we know that as a state of complete physical, mental and social well-being, as well as the empowerment of individuals to use their own health, which is potential, and also to deal successfully with the demands of their environment. So the basis for the management of occupational health and safety, and also it is a written statement which is based on the assessment of the existing hazards and also the risk controls which are practicing at that place. So the principles of the managing hazards, that is the chemicals in healthcare sectors or the healthcare facilities, are same as those for any of the workplaces like factories or in companies which are handling the chemicals. So the first and foremost step is the declaration of the policy and also commitment at the highest level of the management, like resource allocation. So a health and safety program is a definite plan of action. That means for anything to execute, there should be a definite plan of action. So here it is also a definite plan of action should be designed to prevent incidents and also at the occupational diseases. Because any organization, they will definitely vary from one organization to the other, but a program developed for one organization cannot necessarily meet the needs of the another one. Of course, that is obviously it is because of the existing environment, existing occupations, like that. So but always customize the occupational health and safety program to match the requirements and also needs of the workplace. So the health and safety management, that should begin with the initial review of the arrangements in the workplace to secure health, safety and environmental impact of all kinds of hazards in the workplace. It may also include like developing in occupational health safety policies that conforms the employers or the management's commitment to ensuring a healthy and safe place to work and minimization of environmental impact. So an organization's occupational health and safety policy is a statement of principles and general rules that guides the action. So which is the top priority for these management guides of action? The first one is the senior, that means on the top management must be committed to ensuring the policy which is carried out with no exceptions. So the health and safety policy should have the same importance as the other policies of the organization. So the policy statements that can be briefed, but it should be mentioning that priorities list, that is the management's commitment to protecting and promoting the safety and health of workers and also preventing injuries and illness. And the second point is the objectives of the program. And the third is the organization's health and safety philosophy, that is also should be spelled out clearly. And also who is accountable for the health and safety programs. So the general responsibilities of all the managers as well as the workers. And the health and safety that shall not be sacrificed for the convenience or the expediency. And also, it can also be noticed that unacceptable performance of health and safety duties will not be tolerated. So there are stringent rules should be taken place and also that should be executed properly. And the policy should be stated in clear terms so that everybody can understand their roles as well as the regulation, their roles and responsibilities. And also it should be signed by the current president or whatever it is, the executive officer, and it should be kept up to date and also communicated to each worker, those who are working in that particular organization, which is followed for all work activities. So here the occupational health statement is a statement that should be written document that is available to all of the stakeholders, including hospital staff, patients, visitors, and also relatives which are attending the patients. So it must, that means explicitly declare that the existing hazards and also what specific steps are being taken by the management to ensure the health and safety of that particular organization. So for example, a commitment of the management at the highest level to ensure the health and safety of all the healthcare workers, staff, as well as including the contract laborers, patients, visitors, and also concerned the healthcare facilities. And the second point is the name and designation of the employees, that is employees representative, we can say that, who is responsible for occupational health safety, that clearly defining their duties which are related to the occupational health and safety in that particular workplace. And the third point is that the responsibilities of the employers and also employees with regard to the occupational and environmental health and safety. So the system of communicating workplace hazards like potential hazards to the employees, the arrangements to combat such hazards and also the consultation with them. And also a written document which is based on risk assessment should be there. So this is the key part of the statement where the work related hazards that have been identified and also associated risks that have been assessed and documented. So the control measures to eliminate or reduce the risk that must also be clearly mentioned, like the safety statement that must also be clearly mentioned, and also health and welfare of the employees that will be secured and managed like that. So the specific the security is the health and safety policy that is confirming the employer and management commitment to ensuring safety and also health and welfare at the work. So the duties of the employers and the employees with regard to the safety, health and welfare, and the responsibilities of key personnel like the name and also where the applicable job title or the position with regard to the safety, health and welfare, like for example, the responsibilities of the senior manager or the director of the nursing, like that. So it is important to ensure that there are clear lines of responsibility and also the arrangements of communicating health and safety information that includes the emergency plans like as evacuation procedures and also the incident reporting arrangements which previously occurred, also some case studies like this. So a written risk assessment, which is the key part of the safety statement, where the work related hazards that have been identified and also the associated risks that have been assessed and documented. So the control measures to eliminate or reduce the risk that also must be identified from the previous experiences. And also sometimes surprises may happen. So we never know that. We have to have a continuous rapport with that sort of incidents where there is a chance to the hazardous exposure can take place. So any other arrangement for security, safety and health and welfare at the work and the resources which is provided by that such arrangements for occupational health expertise, like immunization arrangements for employees and also health surveillance and also arrangements for working with the contractors and also who shared the building or the who shared the workplace, like that. So the safety statement should be signed by the responsible person like employer or the senior manager, and also that the date should be mentioned properly. So the safety statement must be kept to date, that is reviewed at least annually, but more often required if there are changes at the workplace which might affect workers' health and safety. And also it is brought to the attention of all the staff members and also the those who are working at that particular place who may be exposed to the risks to which the safety statement applies. So if we will see the risk management, how the risk management will go about it. So specifically the risk management is essential a three-step process. That is a hazard identification, risk assessment controls, like that. So some risk assessments that may be simple and arises directly from the observation, like the obstructions in the corridors and creating a tripping hazard. Some hazards may be more complex. For example, the risks which are associated with certain patient manual handling activities. So, an employer can prepare their own safety statement and their own risk assessment if they have, that is, those allotted the duties, that is also know what is involved and have the knowledge and experience of the work activities. And potential hazards, that is also most important. That means everybody should be aware of that, what is going to happen and then how to react for that sort of situation. So employees and safety representatives that should be consulted with and also involved in the risk assessment procedure so that they are also acquaintance with that procedure. But the employer is responsible whole and soul for seeing that the work is adequately done. That means somebody should supervise. That means the execution part is going to be happen in proper manner or not. If an external advisor is appointed to develop a safety statement, it is important to ensure that the person who is appointed has a good understanding of the work activities and also there is some onus should be there to undertake the work. Ensure that any safety statement and also the risk assessment which is prepared is specific to that workplace and also work related activities in that workplace is clearly mentioned or not. So, where there is not sufficient competence in-house with regard to safety, health and welfare matters, the services of the competent person must be obtained. That is a must. So, that means there should be a trained person for that particular activity. So, in this, the first step is hazard identification. So, that means we have to identify, whoever is responsible for that person is to identify the hazards which is associated with the workplace and the work activities. So, we know that a hazard is anything that may cause harm to the human beings. And also the concentrate on the significance of hazards, those that can cause the serious harm or affect many people. Employers will be familiar with the hazards which are associated with the type of work they are involved in, but some of the measures that will also be helpful in ensuring that the main hazards have been included. So walk around the workplace and look at what could reasonably be expected to cause harm. That means we can't sit and then assume that this may happen. But you can go through and then have a walk and then also you can understand that what type of equipment, what type of materials they are dealing with. And also ask the employees or their representatives what they think. So that means we have to take their opinions also, their suggestions also, because practically they are on the field. So they may have noticed some of the things which are not immediately obvious to you. So if the person is a member of a professional organization or similar body, contact them because there are many produce very helpful guidance. And also another point also we can see that check manufacturers instructions or data sheets for equipment or hazardous chemicals, as they can be very helpful in spelling out the hazards and identifying safe work. Because we are also observing and then we are also seeing that if any of the medicine bottles also in any of the product in the market which is available, there are some instructions which we will read before use, because you have to preserve them in cold and dry place like that. Because of the product, the guidelines should be mentioned on that product. In the same way, those who are dealing with that hazardous chemicals, they should know the what type of chemical is, what type of hazard that particular chemical can pose, and also the practices as well as putting them in their true respective, we can say that. So have a look back at work related accidents and also ill health records. That means whatever it is a previous experiences and then what they have recorded. So these normally help to identify the less obvious hazards also. And also one has to remember to think about long-term hazards to health. Example like harmful effects of the repeated exposure to chemicals that may cause the skin irritation, and also some people will have the sensitized skins, sensitive to certain chemicals. So immediately consult the health and safety assistance or the association website for further information on any of that particular incidents on specific topics. That is also best practice. So, and also to consider the best practice guidelines which are produced by the responsible organization. That is the first step. If you will go to the second step, that is the assessing the risk. How to assess the risk? So, risk is the likelihood, great or small, that someone will be harmed by the hazards, that together with the severity of the harm that is suffered. So, in assessing the risk, one has to estimate how likely it is that a hazard will cause harm, and then how serious that harm is likely to be. So, how often and also how many people are exposed to, and what control measures which are already in place. So, consider what further controls may be necessary to prevent that harm. So, it is, even though it is a very general procedure, but if you are dealing with hazardous chemical, it is most appropriate. And also it should be decided if any corrective actions are especially urgent, and also you have to prioritize them. So, depends upon the priority checklist. So, there are specific regulations which are relating to risk assessments for certain types of hazards at work, like manual and patient handling, risk assessments, and hazardous chemicals and biological agents that can display the screen, and also the screen equipment and carcinogens, and risk assessments for the pregnant employees. So, that is also most important. So, the health and safety assessment website, it is also further information relating to these areas. So, that means we are not supposed to lose any chance to understand a particular chemical as well as the hazards, and record the findings. That is also most important. So, once you have seen that what type of risk assessment, and also how to assess the particular risk, and also how to record the findings also. So, the risk assessment must be in writing and also form part of the safety statement. So, that is most important. But for the next person, those who are coming after your duty, that person can also go through that risk assessment statement. So, the safety statement, what it will have? So, the safety statement and the risk assessments, they may refer to specific procedures which are detailed in other documents like operating instructions for equipment and infection control manuals, and also the patient risk assessments. So, the employer can decide whether to combine these documents or whether it is more helpful to keep them separately, which may be the case if the information should be readily accessible near the work activity. So, all these are continuous process. So, but the employer must make sure that the employees are made aware of these risks. That means whenever you will go to your house also, you will give some instructions to your own personals. So, every day, if suppose if you new activity is going on, you will see that, you will ensure that the entire family member should be aware of that one. So just like that, the employer must make sure the employees are made aware of all types of risks and precautions, and know that they wear the check as well as the risk assessment and where the necessary to amend them. So considering the incident reports and also near misses when reviewing risk assessments, measuring performances, health and safety performance. And now next is the how to measure the health safety performance. So it can be monitored and evaluated and compliance with the legal requirements that must be ensured. That is also, there is a good fit between what you say and also you do. There is a policies, procedures, safety statements like that, and what the employer do in reality, and there should be a review mechanism in place to ensure that the which one is the good fit that is maintained into the future. So measuring performance that includes taking account of trends in accidents and incidents, and also progress with compliance with training requirements, and also progress with implementation of additional control measures like identified through the risk assessment procedures or risk assessment processes like that. And make sure that you are continually improving, and also the system for managing safety, health and welfare is effective. And also the duties of employers to people who are not in their employment. So that is also most important. That means employers have responsibilities for the to ensure the health and safety, like service users, visitors, volunteers, contractors like that. So examples of where people may be affected by the undertaking are also most important. That means unsafe premises cause injuries. That means we have to have some boards showing that it is unsafe premises. You are not supposed to go inside. So that can cause injury or harm to a service users or other persons, such as a trip on an uneven floor surfaces, or the contractors are not informed of the location of the asbestos or the fragile roof. And cooperation and coordination with the contractors and others also most important step. So when employing a contractor, like a building contractor, employees must make inquiries about the contractor's procedures like health and safety. So employers must assess the contractor safety statement or their method statement, that with reference to the work to be carried out, and also check how to contractor will integrate their safety arrangements with that of the healthcare facilities. So where two employees including contractors share a workplace, there must be a cooperation and also coordination. That is also most important. That means that is with the regard to the ensuring the compliance with health and safety legislation. That means I am boss and then your worker types, it will not work for any of the organization. That means there should be a coordination between those two people, those who are working, employer as well as the contractor. And also the if we will see that the relevant extracts of the safety statement, which is relating to the hazards and risks, that must be exchanged, so that the employers as well as the employees, they are aware of any risks that may be affecting them. So consultation with the employees, and also employers must consult their employees with regard to safety, health and welfare at work, and provide them with certain information on these matters. And also they will also have, and they will also feel the some ownness, that including the results of the risk assessment, and sometimes they will also guide you, so you can also do in this way. So we have to take all the positive feedbacks, because they are working on the ground, they know what are pros and cons. So the consultation on health and safety matters between employer and employees definitely helps to ensure cooperation in the prevention of accidents and also ill health. Definitely it will grow that organization as such. So as part of the consultation process, employees have the right to select safety representatives. So the employer must recognize the rights and entitlements of a safety representative. So the consultation arrangements that may include a safety committee, and details must be included in the safety statement, like the name of the safety representative and members of the safety committee if appointed, and instruction, training and the supervision should be there. So the employer must ensure that managers and employees have suitable instruction, training and supervision in order to do the job safely. And one more thing, it is also most important over here, is the induction. So induction should be provided for those people to include the key elements of the safety statements, fire and emergency procedures, and also health safety related policies as well as the procedures. And another thing is substitution, that is currently used in the products, that is less hazardous products substituted by the less hazardous products, is one of the most effective ways of eliminating or reducing exposure to that particular product that are toxic or pose other chemical hazards. So we know that a hazard is again, just I want to reiterate that any product or any compound or any chemical or any material that has the ability or a property that can cause an adverse health effect or harm to a person under certain conditions. And some other occupational hygiene methods I would like to emphasize also for controlling employee exposure to chemical hazards, like elimination, isolation, enclosures, local exhaust ventilation process, or equipment modification, and good housekeeping is also most important, along with the administrative controls and personal protective equipment. So all these methods, which are part of hierarchy of controls to help reduce or eliminate the risk of injury or harm by interrupting the path of exposure between the hazardous product and the worker. And elimination and substitution are preferred methods for hazard control, as they remove the hazard at the source. And also a hazard assessment should be done to help to decide if alternative products are appropriate choice or not. Usage of the safety data sheets, and one is also, that is the most important, that is SDS normally we can call it as, and other sources of chemical information compared to the hazards of various products. For easier comparison, set up a table with the categories of each potential substitute. The important properties to compare is the chemical and physical properties of particular chemical hazards. For example, vapor pressure is an indicator of how easily a chemical evaporates into the air, and also exposure by inhalation is the primary route of exposure for many products. So vapor concentrations in the air, which is influence the potential degree of exposure. If a solvent is not very volatile, that means that does not evaporate easily, the potential for exposure by inhalation may be very low. So like that, for example, if you will see the fire and explosion, sometimes the greatest hazards from the product. So that is also most important. And some other point is short-term health effects. That means when comparing animal toxicity values of various chemicals, that can suggest their relative short-term toxicity, like acute toxicity data, that is LD50s or LC50s, that is lethal doses, are the concentration that kill 50% of the test animals which is exposed to chemicals. So that is also most important. And also sometimes two closely related compounds are also there, like aromatic hydrocarbons, benzene and toluene, have similar acute toxic properties, but only benzene is associated with the cancer following the long term or the chronic exposure. And another thing is long-term health effects. That means long-term health effects like chronic lung diseases, that may be more significant than short-term health effects. And skin toxicity is also one of the major thing. And sensitization of the respiratory system, and cancer-causing potential and reproductive effects are also there for the chemical hazards. And exposure assessment, that is also most important. That is a physical chemical properties that can also be used to determine the the likely or unlikely routes of exposure based on the physical state, and particular compounds, vapor pressure, molecular weight, water solubility, and boiling point, like that. So that is also most important. And elimination is the process of removing the hazard from the workplace, that we know. And substitution, we have seen the less hazardous substances should be more important, more valuable than the more hazardous substances. We can, like one example I would like to give, that carbon tetrachloride that can cause the liver damage or the liver cancer. Instead of that, 1,1,1 trichloroethane dichloromethane can be used. And also another compound like benzene, what we have discussed right now, that can cause the cancer. So instead of that, toluene or cyclohexane or ketones can be used. And pesticides which can cause various effects on the body, and we can go for the organic pesticides or the natural pesticides like pyrethrins and organic solvents, and some leaded glazes, paints. So all these can be substituted by the less hazardous substances. So one has to remember that we need to make sure the substitute chemicals or substances is not causing any harmful effect, and to control and monitor exposure to make sure that the replacement chemicals or the substances below occupational exposure limits. So another type of substitution is also there, and for example, if we can see that that is the some for example, I would like to give a dry dusty powder, maybe a significant inhalation hazard. But if this material can be purchased and also used as a pellets or crystals instead of powder, that will be the most useful, less exposure, we can say that. And engineering controls are also there, some methods which are built into the design of the plant, equipment or process to minimize the hazard. So engineering controls which are very reliable way to control workers exposure, as long as the controls are designed. So the basic types of engineering controls, for example process control and enclosures, are the isolation of emission sources, ventilations, and these are the some of the examples I would like to give. And use wet methods rather than the dry when drilling, that one. So for everything we have to use a proper engineering control, and also we have to use and then execute, like instead of conventional spraying, painting, try to dip paint with the brush, or use airless spray painting methods. Like this, these are the some of the examples I would like to give. That is sometimes you can use the automation, that means the less workers have to handle or the use materials. And enclosures as well as the isolation, this is also one of the important method for the management. And also the ventilation, that is also most important. It is also one of the method to control the strategy, that is a local exhaust ventilation, which is very adaptable to almost all chemicals and operations. It will definitely remove the contaminant at the source. And the local exhaust ventilation is an effective means of controlling hazardous exposure. That means a hood should be there that captures the contaminants that can be generated in the air, and also that ducting, and also a fan which draws the air from the hood into the ducts and also remove the air, and also air cleaning devices that can be used. So and also the most important is the systems that increase the awareness are the methods which are also most important. Examples of these are the warning system, and also visuals are audible alarms, warning signs, and other indicators that alert the workers in that situation. And also obviously the administrative controls are there, and work practices should be followed properly. That is a developing and implementing the safety data sheets, and also engineering controls, and also and also safety work procedures, training, education, and awareness, bringing awareness. All these things should be most important. Establishing and maintaining the housekeeping programs, and also most important is education and training. So employee education and training on how to conduct their work safety, that definitely helps to minimize the risk of the exposures. And good housekeeping is also most important. Emergency preparedness. So all these things and then personal hygiene practices and also facilities. So, and how to use the PPE kit. Everybody are aware of, because of the COVID situation, we know that how to use the personal protective equipment for particular hazard control methods like respirators, protective clothing like gloves, face shields, eye protection, footwear. So this is also most important for this one. And it is also important to monitor both hazard and the control methods. Learners, so far we have seen most of the how to manage the hazardous chemicals prevention, and then how to manage at least at our level by following the safety data sheets and also proper guidelines in that particular organization. So it will be definitely benefited for you, and then I hope, and definitely you have to understand, and whenever you will go to the organization in any of the prohibited areas where the chemical exposure is there, please go through the guidelines, and then you have to follow to minimize the chemical hazards risk. Thank you.